If you're dealing with viruses or allergies, your doctor may use a Z-pak steroid combination to treat your problems. We're getting answers today on how this works and who benefits most from this. With more on this is local neurologist Dr. Chad Domingue. Thank you so much for joining us.
Good afternoon. Welcome to the season of sinusitis and upper respiratory tract infections.
I know. Okay, so what's a Z-pak steroid combo?
Yeah, I actually have a sample of each. The pharmacy below me, Cypress Point Pharmacy, was nice enough to provide this. You know, Liz, it's interesting as a physician, a Z-pak and a steroid dose pack is kind of a coming of age. It's kind of like the first time you write something for a family member or a friend. We're all very familiar with these products during the sinusitis and upper respiratory tract infection, but a Z-pak is a azithromycin, it's an antibiotic, and a Medrol dose pack is a steroid, which mimics the steroids in our body, glucocorticoids, and these are used for obviously respiratory infections, sinusitis type stuff, allergy type symptoms.
Okay, and you held them up. That's literally what it looks like? What you held up before?
Yeah, so these are the actual products. So it's a tapering dose of azithromycin. It's a tapering dose of prednisolone, a steroid.
So who would benefit the most from something like this if they wanted to use it? Who would you recommend? What would they have to be suffering from, the symptoms, to treat this?
Yeah, so that's the million-dollar question, and this is the problem with these products. An antibiotic is obviously indicated for bacteria. Strep, staph, Haemophilus influenza, these are the common ones. But it's estimated that 90% of all sinusitis that we treat are caused by viruses. So we're overprescribing antibiotics for viruses, allergies, so forth. It's estimated we're spending about $1 billion a year in America on unnecessary antibiotics. And this is a problem. Azithromycin came up in the forefront with COVID-19, with the cardiac issues. But more than that, we're creating these resistant bacteria because we're overusing antibiotics. And then when you add steroids, decrease your immune system. They can affect your sugar, diabetics. They have a host of other issues. So the problem is these are indicated for people with an active bacterial infection. So positive cultures, purulent drainage, but we're overprescribing them because patients so often want something in their hand as opposed to being told, well, you just have a virus and it'll go away by itself.
So if someone says, I heard about this Z-pak steroid combo, but I want to know what kind of impact it's had on patients, should I try this? What do you say so far based on results? If you're dealing with, the virus or whatever else you're dealing with and you want to try something that's going to work?
Sure. I think a steroid pack's good universally, whether it's allergies, a virus, or bacteria. But again, talk to your doctor. Make sure, if you're taking blood thinners, if you're taking insulin for diabetes, you don't just take steroids and forget about them. There's a host of side effects. The real issue comes down to whether or not you need an antibiotic. And I think, again, when we look at medicine, the CDC actually introduced a campaign called Choose Wisely because of the overprescription of antibiotics. And we're so quick to, I got a runny nose today, my eyes crusty. I immediately go to a Z-pak and a steroid pack. And again, my critique is not always on the steroid pack, but you really need to know whether or not you have a bacterial infection because these Z-paks, these antibiotics have issues, not just to resist the bacteria, but the host of side effects that could be associated with them.
So bottom line, is this something that you would say people should inquire about? Is this one of those things that could be an option?
Yeah. As a kid growing up in Houma with terrible allergies, I was sick all the time this time of year. And I understand, and I go to the doctor, get a steroid shot and these Z-paks, and God knows I probably prescribed them and taking it when I didn't have a bacterial infection. So I understand, people going to doctors, but you really need to talk to your doctor, look at your medications, what's your underlying disease process, side effects with these things. It's not just, take it, forget about it, no big deal. There are consequences to these actions, so you need to have a good relationship and make sure you're treating the right thing.
Treating the right thing and not just masking it. Okay, thank you so much, Dr. Chad. Appreciate it.
Always a pleasure. Good to see you guys.